model of care where the doctors and all providers, nurse practitioners, physician assistants, nurses, all employees in the organization are working for the same organization, and therefore we develop the same strategic plan. We work on the same mission. Our mission puts the patient first. We have the same vision. We're all marching to the same tune. Our vision is to be the leader in the state of Minnesota for quality, safety, service, and value. The real value that we bring is many years, now going on 16 years in St. Cloud and many years in Melrose and Long Prairie, of working with the integrated model where we have care delivery in teams, but I think even more importantly, management decisions and strategic planning made by teams that include the medical staff integrated into this model for management and for the delivery of care. As we have won many awards for clinical quality, including having St. Cloud Hospital selected as one of the top 100 hospitals in the nation for clinical care 8 times in this past approximately 18 years that award has been given. We also were selected by the Twin City Business News Journal as the best workplace among all corporations. This is not a health care specific designation, but among all corporations in the state of Minnesota in the large corporation category, over 1,000 employees, and we were selected as the best workplace for 2 years, the past 2 consecutive years. So I just give that as somewhat of the evidence of the culture of the organization, focusing on patient care, focusing on the value of our employees, and truly engaging our employees in the mission of the organization. I think it's helpful to look to as a part of the transaction, to look at the reference checks, and we have the support of the physicians, and as has been discussed, we will be moving forward with the employment of the Lakeview Medical Clinic staff, including the physicians, on July 1st of this year. If we could have completed the other transaction in as timely a manner as that would have been ideal, this interim year is really required because of the delay that is required to get the 501c3 status of the new corporation. And so that's something we started in the process, working on that as soon as we felt we were prepared to begin that, but that will cause some delay. So with that, I'd be happy to answer any questions. And then I will also invite Jim Davis to make some comments. Jim Davis is the Vice President of Operations for the CentraCare Health System, and can also give some information on the situations that include Melrose and Long Prairie in that transition.
Any questions for Terry or Jim?
I've just got one, and it's probably, I realize there's going to be a year where we're going to be talking about employment issues. However, I'm just kind of wondering, and I realize that everyone from Dell on down is going to have to apply for their job and be interviewed for it. And I'm just kind of wondering, who is going to be in on the interviewing process for employees? Is there going to be any input from the current directors or managers of departments at St. Michael's right now?
There certainly will be input from the current management team and from Dell, of course. So there will be input from the current leadership. And I think both Jim and Dell could give you perhaps even a more specific answer.